Hello, welcome to Healthcare Compliance Pro's presentation on coronavirus preparations. And are you prepared? Precautions for healthcare organizations regarding the coronavirus disease of 2019. Obviously, everybody knows that it is COVID or COVID-19. My name is Eric Christensen. I'm the Director of Client Services here at Healthcare Compliance Pros. With me on this panel is Chad Schiffman. He's the Director of Compliance at Healthcare Compliance Pros, and he'll be trying to triage any of the questions as they come in. Now, this is a re-recording of an earlier presentation where we had some audio difficulties, but we're taking all of the questions that came up as part of that presentation that were submitted, and then we'll be answering them in line with the subject matter as we move forward. Okay? Now, if we don't get to your questions, or if you've got additional questions that come up, don't hesitate to reach out to us. We've got a 1-800 number, or you can email support@hcp.md. Okay, and again, this is a re-recording, but we will be answering the same questions that came up as part of the original recording. Now, he who cures a disease may be the skillfulest, but he that prevents it is the safest. Now, when we talk about prevention, it's trying to stop or flatten the curve. Everybody's, utilizing that phrase, flatten the curve. We know that the, coronavirus is going up. It's spreading out, more than 222,000 cases worldwide, over 9,100 deaths. They talk about more than 80,000 who have recovered. But the deaths and recoveries don't add up to 222,000. So obviously we have a number of that are still in the throes of dealing with the coronavirus infection. So that number we've gotten off of that website. You can go ahead and click through if you'd like more information. The website's very interesting. It's got a world map. You can drill into specific localities, specific countries. You can look at it by region. It's a very good interactive map. Okay, and Healthcare Compliance Pros is tracking virus updates with regard to COVID-19. I mean, there's daily White House briefings, releases from CMS, from the CDC, from OSHA, or the Institute for Occupational Safety and Health. It's constantly updating. So even breaking news, when we were writing this presentation, we started writing this presentation over last weekend. We've been updating it all week, and it seems like we still can't keep up with it. In fact, we have breaking news here about, the White House has issued a statement about social distancing to limiting gatherings to 10 people or fewer. Man, it's crazy what's happening with that, because I still see, they talk about college students who are doing spring breaks down on the beaches in Florida. We see governors going out to dinner with their families and posting it on social media. But it's all about being socially responsible. And the social responsibility is trying to limit the exposure, trying to, again, flatten that curve, okay? So there's a bunch of information in this presentation about COVID-19, specifics about how it relates to influenza, the cold, and other things that have happened, other infections and how it relates to other infections. But all of these infections have similar disease prevention strategies. It's proper hand washing techniques, humming happy birthday to you as you wash both the front and backs of your hands. But that's all information that you can gather other places. We want to make sure that we're discussing strategies that are specific to our mandate here at Healthcare Compliance Pros, which is about compliance as it applies to infection control, as it applies to patient communications, patient check-in process, HIPAA, both now with new telemedicine rulings that we'll talk about, and with regards to now all of this movement to remote work. And what are your privacy and security concerns with remote work? Now, PPE is something that we provide training on specifically to our employees, and it's a matter of making sure that we have similar prevention strategies with regards to PPE. Wearing disposable gloves for all cleaning tasks. Breaches should be reported as possible exposures. And preventing normal non-preventive actions are taken when remote working, including hand washing, touching one's hands, eyes, mouth, I'm sure you've all seen the videos where people are up at a lectern talking about how we need to stop stop doing handshakes, even though the president turns around and shakes the hands of 6 different people at the lectern, or that same person talking about not touching their face while they end up touching their face 6 times in the next 3 minutes. So, it's a hard habit to break, but those are things that we need to be taking consideration of. OSHA is talking about continuity planning, that it can result in a cavalcade of failures as employers attempt to address the challenges with relation to COVID-19. Insufficient resources, workers who haven't been trained. And to meet that requirement, Healthcare Compliance Pros has introduced new trainings as part of our COVID-19 Toolkit, which we'll talk about later as part of this as well. Now, infection control procedures have been the major focus with regards to prevention. Okay, it's about trying to, again, flatten that curve to try and minimize the spread of the coronavirus. And as a result, CMS has said all healthcare providers must immediately review their procedures to ensure compliance with CMS infection control requirements, as well as guidelines from the CDC, as stated by the CMS Administrator, Seema Verma. Okay, if you're ever wondering, you're seeing the White House press conference. There is many people up at the lectern. There's somebody standing behind President Trump, who's a Middle Eastern woman standing behind President Trump. That's Seema Verma, just in case you're wondering who exactly the director of CMS is, or the Centers for Medicare Services. Okay, OSHA is introducing new standards. Infection control isn't necessarily a major focus of this presentation, but the CDC has gone out and done releases specifically about getting your clinic ready for COVID-19. And you can go directly to the CDC site and look specifically at clinic preparedness requirements. There's also some great postings that have gone out there across the listservs, whether it be for your specialty within your practice environment or across the MGMA nationally as well. Okay, so CDC has released interim infection prevention and control guidance. That's all reflected on that, and we're going to talk about some specific infection control procedures here. When you're scheduling patients, when you're doing patient check-in, minimize their exposure, possibly redesign your waiting room, possibly put out postings. Okay, have dedicated patient reception rooms for people who have respiratory illness. Okay, again, consider signs and posters and strategic places, providing patients and employees with instructions on hand hygiene, respiratory hygiene, cough etiquette. Hey, we've got coughing into our elbow, right? Even if you get on Google's site right now, go down to the bottom of the page. It's going to talk about the five things to consider with regard to COVID. It's going to talk about handshaking. It's going to talk about hand washing. It's going to talk about coughing into your elbow, social distancing, all of those things right on Google's search page. Now, the White House released just a couple of days ago their recommendation of 15 days of social distancing or social isolation to try and stop the spread. Okay, and you need to follow your directions to try and stop this spread. And here's the posting. But what I wanted to notice specifically, the backside of that posting talks specifically about if you work in critical infrastructure. Now, critical infrastructure talks specifically about healthcare services. So your responsibilities within the healthcare marketplace is that you have specific responsibilities for making sure that your workforce stays as healthy as possible so that we can be responsive to the coronavirus and providing healthcare services. Okay, so enforcing hand hygiene. Even in the medical practices, studies show that some healthcare providers practice hand hygiene less than half of the time that they should. And again, providing proper signage as it relates to hand hygiene and other hygienic responses to COVID-19. Okay, we're not going to go into specifics on this. We're going to talk about personal protective equipment. All of that information is up on the CDC site. Okay, Monitoring and managing ill or exposed healthcare. Healthcare personnel of respiratory disease should stay home. Okay. If you have known exposure, you should consult with public health authorities. All healthcare personnel provided with job or task-specific education and training on preventing transmission of infectious agents, including refresher training. And not only is our infection control cover all of the necessary standards, we also have specific coronavirus 2019 training provided for our employees. Trained on how to fit respiratory protection devices. Educated and trained on practice and appropriate use of PPE prior to caring for a patient, including attention to the correct use of PPE and prevention and contamination of clothing, skin, and the environment during the removal of such equipment. All of that is provided as part of our training. So we talk a lot about infection control. You can read through this. When we start moving on to how we activate that process, it's all part of your preparedness and response plan, okay? So as you develop an emergency response plan, what are the circumstances that will cause your organization to evacuate or to activate that response plan? Do you consider the levels of risk associated with working in a healthcare facility and the job tasks that your workers are performing on that site with regards to PPE, patient contact, rooming, cleaning? And consider and address other steps that the employers can take to reduce the risk of workforce exposure to COVID-19 in their workplace. What functions are critical or needed for continuing operations? So you're trying to move your employees are trying to move into a environment of self-containment, of limited exposure. Do you need all of your employees to show up for work? Okay. Do you have certain special policies for sick leave, employee compensation, return to work? We're going to talk later about the new COVID-19 legislation that's passed. Families First for coronavirus includes special leave opportunities, extended PTO, the right to return to work, job guarantees, those kinds of things. Explain procedures for handling employee absences during an outbreak. Or if employees can work from home, how do they go about doing so? And how are you going to manage compliance if and when employees do decide to work from home? Because remember, privacy and security policies, security apparatus, proper security techniques in that home environment still need to be maintained. How are you going to keep operations running during the interruption? Maybe it's not a complete interruption. Maybe you now have some staffing issues. Would you temporarily close? How would you handle employees who have to still be paid, but limited reimbursements are coming in? Okay. And how does your organization verify employees can return to work when they've returned from isolation or any quarantining situations? Okay. So remote work to the rescue. Keep your practice afloat. It really is. And probably when we first did this presentation, we had so many people on, we were utilizing so many resources at that time. Maybe that was an indication of how many people are working remote now, maybe even within my own neighborhood. Maybe we had a lot of bandwidth problems with regard to that. But you must develop, we have in our system policies for work at home requirements, internet connection speeds, chat, conferencing applications. What applications will be used? Are they HIPAA compliant? Do you have dedicated workspace? Are your employees self-disciplined? Do they have a strict routine? Are they motivated for a work at home environment? You need to take those issues into consideration when offering remote work. And are you going to actually get any productivity out of them with that? Do you have a sick leave policy even in a remote work situation? What about, again, under the new Families First legislation that passed, where they're allowed time off when a family member becomes sick? Okay. And do you have a policy for a low symptom virus individual, somebody who may be infectious but still can work? Do you still want them working? Are you going to provide them with time off in that case as well? And what about PHI? Again, we talked about this idea of privacy and security still requirement with regards to that remote work environment. I know we specifically had some issues with regard to remote work, with regards to HIPAA. Chad, did you have, what questions came in specifically about remote work and any specific HIPAA guidance that way?
So the first question that we had regarding that would have been, let me get down to it here really quick. Well, actually, first of all, we did just have a question about if the House bill did actually pass.
Okay.
This first one, did that actually pass the Senate and get signed into law?
And it did. It got signed by the president. It got signed by the president almost immediately afterwards. What you have to understand is there were three different levels of the bill. They're still considering the third piece of the bill, but the first two pieces, one of which was guaranteeing emergency production on PPE equipment production. That was the first level of the bill. The second level of the bill was all of this family first information. That was signed almost immediately by the president upon passage by the Senate. And there's still a third portion of that bill that's taking into further considerations economic impact considerations, bailouts for different industries that may be affected. So there's three different portions of the bill. The first two portions have passed.
And then from there, regarding remote work, one of the questions we had is what types of agreements do you have to have in place with your employees to allow them to work from home? And can they use their own devices while working from home?
Well, again, you should have an employment agreement addendum that's allowing them to work at home, and you should take into consideration what types of systems they're going to be using, and will they be using any of their own resources. And that's a negotiation that you should be looking at between yourself and the employee. But if you're going to mandate certain standards, then you're going to have to probably pay that those standards are met. Now, whether it's a question of bandwidth, whether it's a question of security, if you want them to use their own devices at home, are you going to then put into case an acceptable use policy for that device? Do other people have access to that device that may be utilized to access PHI? Those are all considerations about working at home. So you should have an acceptable use policy. You should have an employment policy, possibly an addendum for working at home, and how they're going to be reimbursed, how time's going to be kept, all of those other things should be formally documented. Okay. So they're also critical to determine how the remote employees will securely access PHI. Are they going to be just using cloud-based systems? Are we going to want to make sure that we're running SSL encryption layers? Are you going to be using a VPN? And is your VPN that you're using to dial in, is it scalable? Is it only designed to handle, non-peak remote works, say doctors dialing in to finish some documentation, maybe a biller dialing in, occasionally to finish some coding or documentation paperwork. But now you're moving entire segments of your work population over to that. Does the VPN scale, and does it still provide that level of security to your organization? Okay. Any thoughts to expand on that at all, Chad?
Well, yeah, I mean, you bring up the, BYOD agreements and all those types of things. I
Yes.
guess my thought would be we should make sure that whenever remote work is taken into consideration, that it's part of the security risk assessment as well, and they analyze it from that standpoint.
Yeah, so you have to actually look at the employee's work environment and determine to mitigate or minimize any security vulnerabilities. I know later on we talk about, printing, and I know that's on a later slide. We talk about printing. Well, are they allowed to print at home? And if they are allowed to print at home, what are you doing with regards to document destruction? Okay. So we have, for an example here, they're using a company-issued laptop that is encrypted, requires a unique user ID and password to access. Are you doing automatic log off? Now, these are simple questions to answer if you have the option to give company-issued equipment for them to work at home. But most of you out there are probably not going to be able to scale that up that quickly, even if you want to, in the long term, issue them equipment. The immediacy is, hey, let's get you working at home on the equipment that you already have at home. Because again, most of this is going to be web-based, and it's not going to be any specific equipment requirements to do that work. So then again, are you going to create a different login onto that Windows workstation so that you can determine rights and access privileges, so that you're putting a wall between any PHI generating or accessing applications versus maybe your kids are doing their homework on that same machine, okay? So that's considerations about that remote work and using their own devices. We've got another example here, work from home employees must access the only minimum necessary information, okay? All access and changes to ePHI must be logged. So audit logging to verify that they're only accessing information to which they should have access to, and they're not just out there browsing around now that they're out from under the thumb or the direct observation of other employees. So those are other considerations, and maybe audit logging and checking of audit logging is something that maybe you'll need to escalate in a remote work environment, okay? Okay, here we've got the use of the printer, providing required PHI document destruction practices, but we also, preventing observation of protected health information for unauthorized individuals. Maybe you were doing billing at home, or you had sent, or your billers were working from home already, but now all of a sudden they've got, 3 kids, maybe a husband that are potentially violating their workspace. Is that something that you need to have a consideration? So, okay, so those are other considerations with regards to remote work. And then obviously we can't offer remote work for all environments, and some practices can't do it at all. Maybe they don't even have any infrastructure to allow for that, okay? So are you unable to keep the practice open to meet the COVID requirements for infection control? Maybe you have staffing issues that mean that the practice can't stay open. You may have business interruption insurance that may cover this. I know that a lot of those policies, there needs to be some kind of physical damage. The executive emergency order from the president may give you some legal standing with regards to that business interruption insurance, but you'll have to talk specifically to your insurance provider about those specifics, okay? The Small Business Administration is offering economic assistance in the form of loans. You need to prove a certain amount of financial disruption as a result specifically of COVID. But the IRS has also announced a delay in tax payment deadlines by 90 days. So if you're owing any taxes, even if you have the money, maybe you want to put off some of those payments, okay? Sick leave. Now, we talked about sick leave earlier, and we want to go into it a little bit more. The Families First Coronavirus Response Act that has passed does take into consideration offering 2 weeks of PTO, of paid PTO, for which the employer is responsible, but can get reimbursement on their taxes for any COVID-specific expenses that were a result of that PTO. So you need to document that. That'll be part of your tax returns. You can talk to your accountant specifically about those responsibilities. It also provides additional family sick leave, and none of this is subject to the restrictions that FMLA had, where you had to have 50 or more employees. Now the threshold is 500 employees or less. And the reason that they set the threshold at 500 employees is there was pushback on how many people would cover and the expense to larger employers. And the numbers that they got were that 89% of employers with 500 employees or more already had access to some kind of paid sick leave as well. So this is just extending that sick leave to up to 2 weeks of paid sick leave. And they do have to take their own paid sick leave first if they have accrued paid sick leave in the system, okay? You can't double dip and take the 2 weeks and still maintain the sick leave PTO that you may have acquired on that. Any thoughts on that, Chad? I know you did some research specifically into that.
No, I think you've actually covered with the 500 or less. That's one of the things that we had. One of the questions asked about if provider owners would count towards that. And from what,
Yes. And as far as the research goes that we've seen, C-suites, actual owners, highly compensated employees sometimes are carved out of participating in some of those programs like the 401k or some of the benefits that are available to the rank and file employees. There doesn't seem to be a definition that they're not allowed to participate. So they should be able to participate in both in the Leave Act for family members and the sick PTO accrual of up to two weeks, and the fact that money will be reimbursed as part of a quarterly tax filing. Okay, did I get it all there, Chad?
yeah, well, and there was also an exception that they talked about for healthcare providers and emergency responders. I think that was optional just to make sure that we keep, the frontline staff that we need working with our sick patients working.
Yes. Obviously, we want to keep, and that's one of those things that the CDC talked specifically about, and that was in that release from Seema Verma that I talked about, which was we want to make sure healthcare workers have access to PPE and therefore can maintain a healthy working environment both for themselves and for their workspace so that they're able to meet the demands as part of this COVID pandemic, right? So, okay, so we can go through a COVID risk assessment process. The CDC has put together interim guidance intended to assist in assessment of risk, monitoring, and work restriction decisions for healthcare personnel with potential exposure to COVID-19. So, high risk is anyone who did not wear a face mask and comes into contact with patients infected with COVID-19. Being in a room with a COVID-19 patient in which respiratory secretions were poorly controlled, the provider's ears, nose, or mouth were not protected. High risk. And that means that we need to, put together some quarantining there. Medium risk exposure. Anybody who has prolonged contact with COVID-19 patients, regardless of PPE equipment. For example, healthcare providers, hey, HCP there. But in this case, healthcare providers who are wearing a gown, gloves, eye protection, face mask, including or instead of a respirator during an aerosol generating procedure, which would have had a medium risk exposure. So, would have been considered low risk if it had not been aerosol generating. So if we're not in places where active coughing is occurring, those kinds of things where droplets are not being spread. Low risk, anybody with brief interactions with COVID-19 patients, okay? And proper adherence to currently recommended infection control practices, including all recommended personal protective equipment, which should protect the healthcare provider from having prolonged close contact with patients infected with COVID-19, okay? Now, based on those risk assessment factors, how are we managing what those risk determination factors are with continuing operations? Healthcare providers with no direct patient contact or no entry into active patient management areas who adhere to routine safety precautions, does not recommend testing or system monitoring or special management of people who are exposed to asymptomatic people with potential risks, okay? So we don't necessarily need to do any specific quarantining or anything else depending on their level of risk, okay? We want to prevent the spread by using employee screenings for the COVID-19. So my spouse traveled, they were asymptomatic. Should I self-quarantine? Employers have recommended that their employee check their temperature 2 or 3 times daily, okay? And we know that those were some of the, fever, 100 degrees or higher, a persistent cough, sore throat, headache, all are signs of coronavirus infection and should be part of a determination process for employee screening. If the employee has any temperature increase, they immediately would self-quarantine and notify their local or health state departments. Now, again, this is with regards to healthcare providers, HCP. So I suspect I have contact with somebody who has COVID-19. How should I handle this? Employees with exposure should self-quarantine if exposed. Have your staff check the temperature 2 or 3 times daily and immediately self-quarantine as the temperature increases, okay? Now, one of our biggest topics, Chad, that we had on the earlier presentation was the idea of telehealth. You know, obviously the White House just announced that yesterday that they were making changes to telehealth restrictions. And in fact, they even made the telehealth billing restrictions retroactive to March 6th, which doesn't necessarily make any sense to me, other than they're maybe trying to cover people who were trying to avoid patient contact by doing telehealth appointments for which they might be audited. And one of the enforcement actions here is that CMS has specifically said they're not going to audit telehealth visits where good faith efforts were made to be compliant, okay? So the Office of Civil Rights will exercise enforcement discretion and waive penalties for HIPAA violations against healthcare providers for patients who in good faith utilize everyday communication technologies during the COVID-19 public health emergency, trying to limit direct patient contact. We still recommend using HIPAA compliant video communication as it's needed or as it's available, okay? But that also means that you can use popular applications that allow for video chatting, including Apple FaceTime, Facebook Messenger, Skype, Google Hangouts, Google Meet. You could potentially use Zoom. There are other technologies that allow for specific one-on-one communication, okay? And to provide telehealth without risk, the OCR may seek to impose a penalty for non-compliance related to the good faith position, as long as that good faith was executed during this nationwide emergency, okay? So they are using some restrictions to make it so that they're available. Now we talk about billing, we talk about documentation. Most of your bills are going to be in your standard E&M code sets. You're going to make sure that you're noting that it was a telehealth visit, but all of the documentation requirements, all of the medical decision-making requirements, all of the review of systems requirements or review of the problem list has to be the same to support the 9920, the 202s, the 212s, the 203s, the 213s, what have you. But you're still going to be billing under those. And there are some specific telehealth visits, but you're going to probably be better off billing straight E&Ms based on the complexity of that telehealth conversation, okay? Providers are encouraged to notify patients when these third-party applications potentially introduce privacy risks. For example, using Skype, where other people may be able to attend the conversation. Maybe they have Skype installed on multiple devices, and they're not using encrypted layers for some of those things. And providers should enable all of available encryption and privacy modes when using such applications. But not all applications will allow for some of that, okay? And notice that under this notice, Facebook Live, which is a streaming service out to Facebook channels, Twitch, TikTok, and other similar video communication applications are public facing, which means people can log in and look at that information. It's also hosted on servers for later discovery and rebroadcasting. And they should not be used in the provision of telehealth by covered healthcare providers. Any thoughts on telehealth? I know that there are a lot of, I talked about some of the coding. I talked about some of the applications that are used. What questions did we have with regards to telehealth, Chad?
We have a couple. One of them is, so to confirm my understanding, the providers can use private video conferencing like FaceTime, Skype, WebEx, AnyDex, etc., just so long as they're not public interfacing systems like Facebook Live, TikTok, etc. like you mentioned.
Yep, asked and answered, yes. They can go ahead and use those things. But again, part of that is making sure that we get some kind of disclaimer or acceptance. And a verbal acceptance, as long as it's documented, it would be acceptable. You may choose to up the ante on that. You may have them use the patient portal. You may want to publish a document out there that allows for video conferencing and maybe describe the technology that you're using. But even in that verbal disclaimer, you need to make sure that you're explaining the risks of using whatever technology you're using for that telehealth visit. Okay?
Now we have another question about the author consent. They wanted to know, would it be acceptable for us to get that while the provider is actually on FaceTime or over the phone with the patient?
Asked and answered, yes, the verbal consent is fine as long as it's documented as part of the chart, note. Okay, but again, you can extend your requirement to have it be a signed note. You can require them to actually sign it and email it back. I mean, there's other restrictions that you can place, but a verbal acknowledgement would be acceptable as long as the verbal acknowledgement includes explaining the standards and the risks, and then that's part of a standard data set that you give to every patient. You're using the same type of introduction to the technology prior to giving that consent, and that does explain the risks inherent to the process. Okay. Anything I didn't cover on that, Chad?
One other question with regard to e-prescribing of narcotics. Is that going to be allowed now based on this telehealth?
I haven't seen any specific easing of requirements with regards to e-prescribing. Now, some states and some different types of drug classes are available for e-prescribing. Some of the most closely guarded are not available for e-prescribing, and some of those have even dropped down the amount of allowable prescribed meds. But I haven't seen anything specifically on easing restrictions on e-prescribing as part of this. Have you seen anything like that yourself, Chad?
Here's the statement from the DEA talking about while prescriptions of controlled substances issued by means of internet, including telemedicine, must generally be predicated on an in-person medical evaluation. The Controlled Substances Act contains certain exceptions.
Okay.
One such exception occurs when the Secretary of Health and Human Services declares a public health emergency.
Oh, there you go.
Yeah. So for this case, because there was one, there are 3 conditions that must be met in order for that to happen. First is the prescription is issued for legitimate medical purposes by a practitioner acting in the usual course of his or her professional practice. The second is the telemedicine communication is conducted using an audio-visual, real-time, two-way interactive communication system. And third, the provider is acting in accordance with applicable federal and state laws. So there's still some state law considerations, like you mentioned, so they'd want to verify those.
That might not allow it. And then you've also got the issue with regards to some pharmacies won't take e-prescriptions for some of those narcotics as well. So,
right.
You may run into restrictions. Everything may be fine. You may be able to run the e-prescription through your EMR. It may even be transmitted, but it may not be able to be filled by the patient on their end, either through state laws and or through the actual pharmacy's restrictions. The other thing I want to mention about state laws, that's something that talks about telehealth, was, I don't know how many people are familiar with this, but there was this concept of originating site and the actual provider site. And the originating site is where the patient was actually that was requesting the telehealth visit, and that the provider had to be licensed in the state or had to have a cross-state compact with the state for the state in which the provider was licensed, and where the patient was licensed. I know that the new easing of restrictions with regards to telehealth delivery has made it so that the physician does not necessarily have to be licensed in the originating state during this public health crisis. So, for example, if your patient was in Ohio, that provider had to be licensed in Ohio, or the state that they were licensed in had to have a cross-state compact with Ohio to allow them to practice in the state of Ohio. Again, under this new public health crisis, they've eased that restriction completely. So now you can provide services to patients wherever they're requesting telehealth services from. Okay, so that is something that's been eased as well. So here's some additional examples of HIPAA compliant video communications. We talked about Skype, Zoom. I even did mention Zoom, and I did mention Hangouts Meet. And the OCR will not impose penalties against covered health providers for lack of a business associate agreement with video communication vendors or any other non-compliance with HIPAA rules as it relates to good faith provision of telehealth services during this public health emergency. So before, if you were going to use Skype, you would have to have a business associate agreement in place with Microsoft for using that channel, making sure that any communications or any packets or any possible information with regards to that telehealth visit was protected under a business associate agreement as PHI. Again, the OCR, the Office of Civil Rights, who's in charge of doing all HIPAA enforcement, is not going to impose penalties as part of this process, okay? We talked enough about telehealth. We talked about the Family First Act with regards to coronavirus. What were the other big things that were talked about, Chad, when we think about questions? Any big questions that I missed?
One other big question would be let me scroll down to that particular question is, are there specific codes that apply to it? And we know the short answer to that is yes, there are specific codes.
Yeah.
But that normal billing coding guidelines do apply.
Yeah, we talked about different providers, different insurers. While you're looking for that, I'll talk about the insurers. You'll need to specifically talk to these announcements with regards to coverage for some of these visits were specifically made by CMS. So you may have to talk to your specific payers about their participation in telehealth, whether they're easing restrictions for certain documentation standards. Now, again, that's only with regards to the billing portion of this. The HIPAA standards have been relaxed. You must make good faith efforts. You must do proper communication. You must get the sign off. But with regards to billing, it may be specific to the payer, and you may need to inquire as to which specific code sets they will support. But as I mentioned, CMS talks specifically about the basic E&M coding, the 992XX codes, that they will pay for those based on documentation to support them. Did you get to that question, Chad?
Yeah, and so that's exactly what it talks about with using the telehealth.
Well, I was able to anticipate that, all right?
POS modifier, and then also CMS has a summary of the telehealth codes that they'll need, typically G codes, to go along with it.
And again, all of that information is part of our COVID-19 toolkit. Hey, what a great lead into that. So as part of our response to COVID-19 and making sure that we're holding our practices accountable and that we're doing our necessary part for infection control, HIPAA communications, necessary handouts, all of the necessary training, even reporting forms and incident management forms. We're going to have a weekly Q&A webinar beginning next Tuesday. You can get onto our site and sign up for that Q&A webinar. That Q&A webinar will not be like this. The Q&A webinar will strictly be, what are the major issues that have come up over the weekend? Do you have any questions? We'll have experts on that Q&A to help answer some questions. And those webinars will be recorded and posted to our website as well. We'll also have all of the links to the CDC updates, as well as links to CMS, and we'll have tip checklists and other working materials to help you stay up to date with this constantly changing COVID-19 compliance environment. And when I mean constantly changing, it feels like I put a presentation together and then the White House puts together a 2-hour-long press conference and I've got to rewrite the entire presentation. So it is constantly evolving, and that's why we're moving to that weekly webinar to make sure that we've got those updates. Okay. Anything you would like to say in closing, Chad, before we close this re-recorded webinar from earlier today?
Well, I would say one of the questions was whose recommendations should we follow? And I think that's why we want to provide this toolkit and these webinars, is there are just so many recommendations out there to keep tabs of. But if you are looking for them, we would recommend stuff like, looking at the CDC, CMS for their guidance, OSHA, HHS, and the local health departments. But we're going to do our best to keep it all up to date and get that information to you on a weekly basis.
We have links. We have links within the toolkit to the state health departments and their specific landing pages with regards to COVID-19. Some states, even some local municipalities, are doing additional COVID-19 restrictions that may need to be updated for your specific practice, or may directly impact your physicians and even telehealth visits, providing proper advice and proper assistance and guidance to the patients based on where their locales are. So all of that would be included within that toolkit as well, okay? Again, you can reach out to us at support@hcp.md. There's our 1-800 number. I want to thank everybody for coming on and listening to our re-recorded webinar. Again, I want to apologize for the earlier audio and technical issues that we had. But if you did listen to this, send me an email. I'd love to hear how many people actually ended up recording or listening to this recorded webinar. As always, don't hesitate to reach out to HCP if we can help you in any way. We're always there to solve your compliance issues. Have a great day.